So today's lecture will be on the gallbladder meridian. So the full name of this meridian is the gallbladder meridian of the foot Shaoyang. And because it's a young meridian of the foot, this means that it will run from the head down to the feet. There are 44 points in total, and the common indications between points are for disorders of the lateral side of the head, the lateral side of the body, and the liver and gallbladder. This is things like headaches, tinnitus, deafness, etc. So next, let's look at the course this meridian flows. So if you look at the picture on the right, you'll see a little animation showing the pathway that this meridian flows. From the ear, around the head, down the neck, past the lateral side of the body and then the lateral side of the leg, all the way down to the foot. So now let's look at the flow of the meridian in a bit more detail. This image here is just zooming in on the head portion of the flow. So this meridian begins at the outer canthus. This is the red dot on the image. It then descends slightly to the ear and then curves back up to the corner of the forehead at GB4. It then curves downwards again and then goes to the retroauricular area, which means behind the ear, and then it runs up again to GB14 on the forehead. It then once again curves backwards all the way around the side of the head, all the way back down to behind the ear at GB20. It then continues down the neck and then connects with GB14 at the spine. And then in this slide, we're going to take a look at where the meridian flows on the torso. So from GB14 on the spine, it re-emerges at the supraclavicular fossa over there, and here it branches. You can see the red branch and the blue branch. So we're going to follow the red branch, which is also known as the straight portion of the channel. And this goes downwards from the supraclavicular fossa and passes in front of the axilla over here. And then it travels along the lateral aspect of the chest and through the free ends of the floating ribs down here. And then it continues descending to the hip region known as GB30, and that's where it connects with the other branch. It then continues descending along the lateral aspect of the thigh over here, and then down to the lateral aspect of the knee, and then continues descending along the anterior aspect of the fibula over here, all the way to its lower end at GB39. It then reaches the anterior aspect of the lateral malleolus over here, and then it travels along the dorsum of the foot to the fourth toe over here, and ends at the lateral side of the tip of the fourth toe. So now let's look at the two branches. The first branch is called the retroauricular branch. So I want you to ignore all the red lines. We're going to look at just the pink lines. So it arises behind the ear over there. It then enters the ear and re-emerges in front of the ear at the preauricular region. It then ascends to the posterior aspect of the outer canthus over here. From here, it continues on this red line that descends to stomach 5 over here, and then ascends back to the infraorbital region to meet with the Sanjiao meridian of the hand Shaoyang. And it then passes back down through stomach 6 and continues down the neck. From the neck, it continues descending to connect with the main meridian at the supraclavicular fossa. It then branches immediately again, and it follows the blue pathway now, which descends the chest and passes through the diaphragm to connect with the liver and its pertaining organ, the gallbladder. It then runs inside the hypochondriac region and comes out from the lateral side of the lower abdomen near the femoral artery. From here, it runs superficially along the margin of the pubic hair and goes transversely to the hip region to connect with GB30 over here. The second branch is called the dorsal foot branch, and this branch runs from the dorsum of the foot. So it runs at the dorsum of the foot over here. It splits off from the main meridian at GB41 Zuling Qi and runs along the first and second toe instead of the fourth toe, and runs to the distal portion of the big toe and passes through the toenail. Here is where it links with the liver meridian of the foot Juyin. And this is the red dotted line on the image. So next, let's look at the frequently used points. So as you can see, there's quite a few points that we use often. And of the 44 points in this meridian, 14 of them are frequently used. So that's quite a large percentage. So now let's move on to the points of this meridian. The first point is Tongzi Liao, GB1. So this point is located in the hollow on the lateral side of the eye. So here's the eye, and we've got to go lateral to this. We're looking for a hollow, and this hollow is approximately half a tsun lateral to the outer canthus. So here's the outer canthus of the eye, and we've got to go half a tsun lateral to that. So the indications for this point, it can be used for local conditions such as headaches, redness with pain and swelling of the eye and cataracts, and it can also be used for tearing due to light. So this is when the eyes start to tear when they're exposed to light conditions. Needling is horizontal insertion, 0.3 to 0.5 tsun, and we're going posteriorly, so we're going in this direction. And we can also prick this point to cause bleeding. The next point is Tinghuai, GB2. This point is found in a depression formed when the mouth is open. So if you remember from the previous lectures, when we did the Sanjiao meridian, we did a similar point to this one. We did Sanjiao 21 Ermen, and that was just anterior and superior to the condyloid process of ear. And this point is the third of 3 points located in this region. And this is the most inferior of the 3 points. And it is located anterior to the intertragic notch. So the intertragic notch is on the ear. It's this part of the ear over here. So we're just anterior to this, and we're posterior to the margin of the mandible's condyloid process. So that's around here on the image. But if you look at these circles on the bottom, here's the condyloid process over here. And we've got to be posterior to the posterior margin of the condyloid process, which is this part over here. So we're between these 2 points here. This point can be used for local conditions such as deafness, tinnitus, and otorrhea. It can also be used for toothache, deviation of the eye and mouth. Needling is perpendicular insertion, 0.5 to 0.8 tsun, and then the mouth must be kept slightly open. And this is due to how the condyloid process moves. As you can see on the second circle on the bottom right, as you can see when the mouth opens, the condyloid process shifts forward and allows this opening to form between the condyloid process and the ear. And then this allows us to needle into the scap. The next point is Shangguan, GB3. So this point is located anterior to the ear in a small depression above the margin of the zygomatic arch. So if you look at the image on the right, this is the zygomatic arch here. And we already did in the stomach meridian, stomach 7, which was below the zygomatic arch in this depression here. So this one is directly above it, and it's level with where stomach 7 is. This point can be used for tinnitus, deafness, and cerumen, which cerumen is excess earwax. And they can also be used for toothache, facial pain, and deviation of the mouth and eye, or for trismus. Needling is perpendicular insertion, 0.3 to 0.5 tsun. And because there's not a lot of muscle between the skin and the bone, it's a much shallower insertion. The next point, GB4, also known as Hanyan. This point is located within the temple area, at the junction of the upper quarter and the lower 3 quarters of the distance between Towei, stomach 8, and Cuban, GB7. So stomach 8 is over here, and GB7 is down here, and we've got to divide this distance into 4 equal parts. So here's 1, 2, 3, 4, and then we're at the junction of the upper, this one, and the lower 3. So that's right over here, and that's the location of GB4. And then the indications, it can be used for local conditions such as migraines or vertigo. It can also be used for epilepsy. And then finally, it can be used for tinnitus and pain of the outer canthus, so that part of the eye, and then toothache. Needling is horizontal insertion, 0.3 to 0.5 tsun. And then the direction of needling is based on the condition. So if you want to treat a condition of the eye, you'll angle your needle towards the eye. Same for if you wanted to treat a condition of the ear, you could angle it towards the ear. Or you could angle it based on the direction of flow of the meridian, either following the meridian or going against it. The next point is Xuanlu, GB5, also on the temple, and it's at the midpoint between stomach 8 up here and GB7 down here. So once again, we can divide it into 4 equal parts, but because it's at the midpoint, we actually only have to divide it in half, and that's where this point lies. It's got similar functions to the previous point. It can be used for migraines, redness with swelling and pain of the eye, and toothache. Insertion is the same as the previous point, horizontal insertion, 0.3 to 0.5 tsun, and remember the direction is towards the targeted area. Next is Xuanli, GB6, also on the temple. So this point is at the junction of the upper 3 quarters and the lower quarter of the distance between stomach 8 up here and Cuban GB7 down here. We've got to divide it into 4 equal parts again, and we've got to have 3 quarters at the top and 1 quarter below. And the indications are similar to the previous points. It can be used for migraines, redness with swelling and pain of the eye, and tinnitus. And then our needling is the same, horizontal insertion, 0.3 to 0.5 tsun. The next point is Cuban, GB7, also located on the temple, and this point is level with the anterior apex of the ear, known as Jiao San, Sanjiao 20. So firstly, you've got to find Sanjiao 20 at the apex of the ear, and then we've got to go just anterior to that, and we're going to be just posterior to the preauricular hairline. So this is the hairline over here. So we're posterior to this hairline, but we're anterior to Sanjiao 20. The indications for this point can be used for local conditions such as headache or trismus. It can also be used for toothache and swelling of the cheek and other facial problems. Insertion is horizontal insertion, 0.3 to 0.5 tsun. The next point is Shuigu, GB8. This point is also in the temple region, but it's in a small depression directly above the apex of the ear, about 1.5 tsun above the hairline. So this is the hairline, and we've got to go 1.5 tsun above it, and we're at the level of the apex of the ear, which is where Sanjiao 20 sits. This point can be used locally for headache and dizziness, or it can be used for acute or chronic infantile convulsions. Our insertion is once again horizontal, 0.5 to 0.8 tsun. The next point is Tianchong, GB9. So this point is located 2 tsun within the hairline, directly above the posterior border of the auricular root. So this means the root of the ear over here, and it's 0.5 tsun posterior to GB8, which we just found. This point can be used for headache, epilepsy, and gingivitis, and its insertion is horizontal, 0.3 to 0.5 tsun. The next point is Fubai, GB10. So this point is located posterior and superior to the mastoid process. Let's bring in an image of this. And here is the mastoid process. So we've got to be posterior and superior to the mastoid process. And this is the region over here on the image. And then we're at the junction of the middle third and the upper third of a curved line joining Tianzhong, GB9 up here, GB9, and Wangu, GB12 down here. So we divide the distance between these two, and we curve the line according to the ear, and we divide it into 3 equal parts, and this is on the junction between the middle third, this third, and the upper third over here. So this point can be used for headache, tinnitus, deafness, toothache, and other diseases of the head and face. It can also be used for goiter. Needling is horizontal insertion, 0.3 to 0.5 tsun. The next point is Tou Chao Yin, GB11. So this point is posterior to the ear, and it's in the depression on the junction of the middle third and the lower third of a line drawn from Tianzhong, GB9 here at the top, and Wangu, GB12 down at the bottom here. So we draw that line following the ear, and we divide it into 3 again, and this time the junction between the middle third, this third, and the bottom third is where this point lies. So the junction is where the 2 points join over here. Indications, this point can be used for headache, vertigo, pain and stiffness of the neck, nape, and other diseases of the head and neck. It can also be used for tinnitus and deafness. Our needling is horizontal, 0.3 to 0.5 tun. The next point is Wangu, GB12. So this is one of the points we need to use to make that line so we can find GB11 and GB10. So how we locate this point is that we're going to palpate for the mastoid process, and then we're going to look for the depression which lies just posterior and inferior to the mastoid process. Indications, it can be used for epilepsy, and then headache, pain and stiffness of the neck and nape, pain and swelling of the throat, swelling of the cheek, toothache, and other disorders of the 5 sense organs. Our insertion is also horizontal, 0.3 to 0.5 tun. The next point is Benshen, GB13. So this point is located on the lateral part of the forehead. So this part of the forehead here. And it's 0.5 tun within the anterior hairline. So here's the hairline. We're going to go half a tun in. And then that's 3 tun lateral to do24. So Shenting do24 is also half a tun in the hairline, but it's at the midline. So from here, we're going to go 3 tun lateral from the midline, and that's where GB13 lies. And this is 2/3 of the distance between stomach 8 over here and do24 over here. Indications, this point can be used for epilepsy, infantile convulsions, stroke, headaches, and dizziness. Needling is horizontal, 0.3 to 0.5 tun. The next point is Yangbai, GB14. So this point is located on the forehead, and it's 1 tun above the middle of the eyebrow. Here's the eyebrow, and we've got to go to the midpoint, which is Yu Yao, an extra point, and we've got to go 1 tun up from there. And this is directly above the pupil when the eyes are looking straight ahead. So you're going to ask your patient to look straight ahead, and then the pupils will give you the midpoint of the eyebrow and also where this point lies. The indications for this point, so it can be used for headache, specifically frontal headaches because of this point's location, but it can also be used for eye pain, blurred vision and twitching of the eyelids, and other disorders of the face. And it's a horizontal insertion, 0.5 to 0.8 tun. And remember that this is a frequently used point. The next point is Toling Chi, GB15. So this point is also located on the forehead, but it's half a tun into the hairline, just like GB13 was, but it's directly above GB14. And this is midway between do24 and stomach 8. So when you compare this to GB13, GB13 was 2/3 of the distance from do14 to stomach 8, which was around here. Also, they both are half a tun into the hairline. They're just their distance lateral to do24 or the midline is what varies with these 2 points. This point can be used for headache, pain in the eye, dizziness and myopia. It can also be used for nasal obstruction and sinusitis and infantile convulsions. Our insertion is horizontal, 0.3 to 0.5 tun. The next point is Muchuang, GB16. So this point is located 1.5 tun superior to the anterior hairline. So here's the anterior hairline. We have to go 1.5 tun superior or posterior. It's actually slightly superior and slightly posterior. And we're going to be 2.25 tun lateral to the midline of the head. The indications, this point can be used for headache, pain in the eye, dizziness, excessive lacrimation and dim vision. It can also be used for nasal congestion and infantile convulsions. Insertion is similar to previous points. It's horizontal, 0.3 to 0.5 tun. The next point is Zhengying, GB17. This point is 1 cun posterior to Muchong, GB16, and it's 2.25 cun lateral to the midline, and it's 2.5 cun superior to the anterior hairline. So it's 2.5 from year to year, or 1 cun from year to year. This point can be used for headache, vertigo, dizziness, and other diseases of the head and eyes, and the insertion is horizontal, 0.3 to 0.5 cun. The next point is Chengling, GB18. So this point is found 1.5 cun posterior to Zhengying, GB17, and 2.25 cun lateral to the midline of the head, which is 4 cun superior to the anterior hairline. So if you see the image on the top right, these points are all level with one another, all in a straight line, which is 2.25 cun lateral to the midline. The variations is in the distance from the hairline. So Toling Chi, GB15, was half a cun into the hairline. Mo Chang, GB16, is then a further 1 cun from GB15, or if we add the two together, this 1 plus the 0.5, 1.5 from the hairline. Zhengying, GB17, is 1 cun behind Mu Chang, which makes it 2.25 from the hairline, because it's this 1 plus the half is 2.25. And then Qingling is 1.5 cun behind Zhengying, GB17. So this means that if we add 1.5 plus the 1 plus the 1 plus the 0.5 here, that's 4 cun from the anterior hairline. And Chengling is used for headache, vertigo, pain in the eye, stuffy nose and epistaxis, and the insertion is horizontal, 0.3 to 0.5 cun. The next point is Naokong, GB19. So this point moves now to the back of the head, and it's above the occipital ridge and directly above Do16. So here's Do16, here's the occipital ridge as well. So we're superior to both these points, and it's lateral to the external occipital protuberance. So the external occipital protuberance is normally around here, and then we've got to go lateral to it. Approximately 2.25 cun lateral, and then it's level with Do17. This point can be used for febrile diseases, headache, pain and stiffness of the neck and nape, dizziness, redness and pain and swelling of the eye, pain of the nose, deafness and other disorders of the 5 sense organs. It can also be used for palpitations and epilepsy. Needling is horizontal, 0.3 to 0.5 cun.